Welcome to the Girl Doc Survival Guide. Today, I'm pleased to be with Dr. Madeline or Maddie Lagina, MD, MPH. Dr. Lagina is a clinical assistant professor of pulmonary diseases and assistant director of the Pulmonary and Critical Care Fellowship at the University of Michigan. She attended Emory University for college and medical school and trained at the University of Michigan. She has written on the PERMA model for physicians, and that will be our main topic today. Welcome to Maddie.
Thank you so much, Christine. I'm so glad to be here.
Yes, thank you. Before we hit the PERMA model, can you start by sharing a personal anecdote?
Yes, absolutely. I had this AP bio teacher in high school, and he was this really gregarious, energetic, enthusiastic guy. And I loved going to his class because he showed so much genuine excitement for the material he was teaching and genuine care for the students in his class. He really valued connection and learning. He proved to me in a very tangible sense that joy is a communicable emotion. I would sit in his class and get more and more excited about biology and the sciences. I thought that was such a special thing. It left such a lasting impression on me about education, the way I view it as a whole. It grew with me through my roles as an educator myself in college, in medical school, public health school, and through training and now as an attending. And I feel as long as you can commit to being excited in the moment and commit to being excited about having learners and teaching learners, you have a shot at generating something truly special. That's so inspiring. So shout out to Mr. Zarni in Traverse City, Michigan, for how excited and wonderful he was as an educator.
That's awesome. I love your story because it's true. I think teachers, especially high school maybe, don't get enough credit. They really can change students' lives. I still remember some of my high school teachers, but I've never really gone back to my high school. But Mrs. Lee, Ms. Whittekind.
Incredible. Isn't it incredible? You're exactly right. For people like us who have been through years, I'm not going to say how many years, but years and years of training and education and had many people give us lectures and be our teachers. It's a testament to how important those formative moments are in education, and they can come every now and then, maybe early on in the process or later on, but there's this moment of like connection with one or two of your teachers who you really resonate with. And I think that's really special. That's one of the most special things to me about education. I'm grateful for him.
Shout out to Mr. Zarni. I also am interested what you said. You said joy is communicable. Can you expand a little on that?
Yes, absolutely. This was actually one of the motivators that I had behind writing the paper that we're going to talk about today. There are communicable or contagious emotions, and one of those is joy. Another is burnout. Burnout is also communicable. If your teachers are burned out, then the students that learn from them are more likely to inherit those challenging emotions or challenging perspectives. When I read about a little bit more about joy in the positive psychology literature, I just got so excited because I thought, that's it, right? That's got to be it. Token joy. That is really the underpinning for the paper that we wrote and the interest that I have in academics.
I spoke to a researcher in emotions named Dr. Batya Mesquita. Her concept is that emotions are actually between people. They're not like inside my head or my body. It's actually between you and me. That resonates with me, what you just said about joy, about burnout. I read your paper about the PERMA model because I had spoken to a colleague of mine named Dr. William James, and he had mentioned Dr. Martin Seligman's work on PERMA. Can you explain the PERMA model, what that acronym is, and your interest in it?
Yeah, absolutely. The PERMA model is, like many other models, just a framework that we can use to better characterize the positive set of emotions that we experience that can help us lead to human flourishing. Seligman calls it overall well-being. The model has 5 different domains. It's an acronym for each of those domains. So P is for positive emotion. This is like savoring those little happy feelings that you have when you're doing your favorite hobby or reflecting on a moment that brought you a lot of sort of happiness in your day. E is for engagement. This is a really cool one. This is really about flow. Flow is a subconscious kind of loss of attention when you're so deeply attentive to something. Seligman calls it getting lost in the music. This is defined by someone practicing something at the top of their character strength. And so if an educator is creating a lecture or refining their lecture, they may enter a flow state where they're working for 6 hours and all of a sudden they look up and it's midnight and they have to go home. That's what engagement is. And then R is for relationships, which is pretty self-explanatory. This is what we were talking about earlier and the value that we have in these relationships and relational moments. And then M is for meaning. And meaning is defined in this model as participating in something that is more than self or greater than self, having a cause, contributing to the common good. Those things are considered in alignment with meaning. And then the last category is A. A is accomplishment. And that's, again, pretty self-explanatory, but it's working toward your internal goals. So you're setting a goal for yourself and it's in alignment with what your kind of internal wishes and values are. That's accomplishment. The idea is that if you hit dingers in every category, you're flourishing, right? If you're doing really well in positive emotion, engagement, relationships, meaning, and accomplishment, then you are flourishing.
Nice. Okay. And so you wrote a paper about PERMA as related to physicians.
I wanted to use a positive psychology model to help us understand where really good educators in medicine were deriving their sources of joy. I was most interested in the professional aspect because we had talked all the time in my medical training in medical school and residency and fellowship about burnout and how challenging it is to treat, overcome, how challenging it can be to reduce the symptom burden. And I just thought, why isn't anyone talking about the corollary here, which to me was, why aren't we trying to amplify sources of joy for physicians at work? And I had attended many pizza parties, wellness pizza parties, and thought, gosh, I wish that I myself had a better sense of what brings people joy at work, specifically physician educators. I wanted to also pick that group of people because they have in their hands the most impressionable next generation of physicians. And if I understand that joy is communicable and so is burnout, then it was important to me to understand how these highly skilled educators who had the future generations in their hands derive joy from their work. That's what prompted the investigation and how we ended up writing the paper.
I love it. It's really applying, it seems to me, the positive psychology movement to medicine. Why not prevent the burnout from the beginning and focus on the positives, as you're saying? What did you find out with writing about PERMA as related to physicians?
PERMA model is both a model used to characterize and understand positive emotions at work, but you can also make it work for you on an individual level. So if you look at those areas where people find a lot of fulfillment and joy, and one of them is lower than the others, then that might become a target for amplifying joy at work. And so the idea of our investigation was to just figure out what are the targets. We looked at highly rated physician educators, and we did a deductive coding of the responses to their interviews. And we found that a lot of the people who were in the highly rated educator group had very robust sources of joy within each category. So they were like, oh yeah, let me talk about all of the positive emotions that I get from the moment when something clicks with a student. Or, oh yes, absolutely, I derive meaning from teaching the next generation of people. And they weren't given the PERMA model to concoct these things. They were just speaking free form about where they derive joy. A lot of them were saying a bunch of stuff in each of these individual domains. And so we felt like, gosh, this seems to really well describe the breadth of professional joy for educators.
Yes. To summarize what you said, what you found in your study is highly skilled educators, highly rated educators have positive emotions and they feel meaning and they feel a sense of accomplishment when they're teaching, and the relationship with the learners is important and they're engaged in it. It's a state of flow. So like earlier when you said if you can hit something in all 5 of those areas, you're probably flourishing. So essentially, even though these highly skilled educators weren't given the PERMA model ahead of time, just extemporaneously, when they were asked, what does bring you joy, their answers were just hitting all of these 5 areas.
Exactly right. They responded with a lot of color in their responses, and they talked about various things that would fall really nicely into each of those categories, even though they hadn't been given any of those categories.
Well, it makes sense because I'm still a learner. As a learner, I have to say that more and more, I do believe that a really good teacher is so important. It can make something that seems really difficult much easier. And it makes sense about the highly skilled educators, what you found in them, because even going back to your teacher from the beginning and the 2 teachers I named that I remember from high school, just offhand, they were engaged with teaching and they cared about us as students. And I think they did find meaning. Like Ms. Whittakind was a math teacher. And I remember during the summers, she would go take advanced math class. She loved math.
I love it. I love it. People actually have looked at this as well. Does it matter if your teacher is good versus enthusiastic or open and energetic? The answer is no. Enthusiastic, joyful teachers are the people who inspire students to learn more and to connect with the material. If you put skilled people who derive a lot of joy from doing the job they're doing in front of learners, you just have the best combination for everybody. You have a lot of opportunity to spread joy and to spread enthusiasm and inspire people in those circumstances.
Nice. You said you were a resident when you did that work. Has it had a lasting influence on how you approach your job?
I would say definitely. It's really important to enter a space and be cognizant of the energy that you're putting out to the people around you, particularly learners, because they are particularly sensitive to contagious emotions. And I think if you really embrace the attitude of, I'm going to be joyful in this space, not necessarily I'm going to feel happy all the time. I work in a medical intensive care unit. We have a lot of sick patients, but I try really hard not to create an environment that is without enthusiasm, because I feel that's the key ingredient. If you can make somebody else's day the tiniest bit better, that includes your colleagues, patients, people around you, then you're going to go home and feel better about the work that you did that day. That's probably the main takeaway from the paper and something that I'll keep with me as I continue my career as a medical educator.
I like it. So that might then be your answer to this question. Do you have tips for flourishing in your career or life for others?
Gosh, if my name was Martin Seligman, I feel like I could tell you so many more tips for human flourishing. What I would say is nobody has it figured out. I wish I could say that doing this type of academic work has given me this armor against burnout. And like I said, I'm not like this perpetually radiating that source of joy at work. But I do think that being intentional about those positive emotions, taking a moment and reflecting on the things that went well, taking a moment to be grateful, identifying the times when you really connect with something, trying to prioritize connection, the people around you is like a super important part of the process. In my job as an intensivist, it's even more important because a lot of times the clinical work is challenging, it's fast-paced, it's emotionally charged. And if you let it take you away from this sort of center, your connection to the work you're doing and your connection to your team, then you can get lost in the day-to-day. Just reminding yourself that, okay, we can take these moments and be grateful and try to focus on the positive. And even if you're not feeling it, try to put joy out into the world for the people around you. I think that's probably the best I could say. I'm talking about it in a professional context, but of course you could do that in your real life too. I do not always do those things, but I try my best. That's as much as we can do.
I think you're right. More and more, I believe, and I guess it's sad because it means in the past I didn't, but I believe my best has got to be enough. It has to be because I'm not perfect by any means. There are days where I won't as you said, I definitely will not radiate any sort of joy, much less even much positive energy. And maybe I'll be radiating negative energy. And then hopefully someone else sees me and is, oh, you seem off today. And then they can give me positive energy and make up for my lack.
That's right. I think that's a hugely important part of this whole thing, that connection piece, where we started talking about emotion as being relational. None of this happens in a vacuum, right? We're talking about interactions with people and connections with people, drawing a lot of strength from that and trying to reciprocate some of those positive emotions can really generate something special.
It comes exactly back to what you said in the beginning, that joy is communicable. And I really love that. Do you have any final thoughts?
I just want to congratulate you on the work that you're doing. I'm so honored to be here. It's such a joy to talk to you.
Thank you, Maddie.
My pleasure. Thank you so much.